Hey everyone, it's Dr. Bird with Chiro Movement Muscle Joint Clinic. As the springtime comes around, we've got more sports and activities that happen that are going to affect a lot of elbow. Tennis is going to get really big. Golfing is going to get big here in Utah again. We want to make sure that we're not having these awkward elbow conditions that we see pretty often when it comes to these types of sports. So when we're looking at an elbow, let's just run through a few things real quick. Just name of the bones real quick. Humerus is up here, radius is here, and ulna is here. It's kind of important to know that stuff when we're talking about where muscles are going back and forth. 4, full range of motion. We just want to see that the person or the patient has good elbow extension, good end range elbow flexion, any laxity with a force across from lateral to medial. We're looking for just a laxity on either side and pressing. And then how do they rotate? Rotation in the forearm, you're getting some of it happening up here at the elbow and a lot of it down as the bones cross down here. That is called pronation, supination. Now, as we're looking at someone that might have symptoms of the tennis elbow, that would be on the outside of the elbow right here, or lateral side of the elbow. A lot of those muscles that start here do come down and connect up close to the base of the thumb here. As we're working through musculature, we're looking for tightness, bands of tension, trigger points, that type of stuff. Some of our basic tests to test out a lateral tennis elbow, one of our favorites is a go-to where we're going to hold passively, just be very strong through here. She's going to extend her fingers and resist me pushing down on her fingers here. We're looking for any sort of reproduction of pain up in the forearm that may direct us towards a certain condition. We're not going to go over that right now. As an acute case of elbow pain, you may see some swelling, some redness, and very tender as you touch the areas next to the elbow. When I'm assessing, we're going to look from low to high and to see what's going on via tension in the, not just the elbow itself, but up into the upper arm next to the bicep on here and tricep, those little areas right there. Just check for tension and then scan on the way down. Now, one simple test for just lateral epicondylitis or condylopathy is a forearm straight, wrist flexed, and I'm resisting as she's trying to push up. We're looking for a reproduction of symptoms here. If there's a reproduction, it's pointing us more in the direction of what we already suspect as a lateral epicondylitis and epicondylopathy. Okay? So if you are someone that has this tennis elbow, this lateral elbow pain, here are some of the treatment options that we use in our office. We have to use a lot of soft tissue manipulation to relieve those symptoms, to get basically like a first aid and get the main part of inflammation down. From there, if we know that there are certain activities that you're doing that are creating that continued pain, you may have to rest for a little bit. That's part of this. From there, again, soft tissue, possibly some rest, possibly some bracing. That's not a bad option for tennis elbow. After all of that, we want to show you some of the exercises that are good rehab for tennis elbow, lateral epicondylopathy, that type of stuff. We're going to show that in our next video where we go over those exercises that may work for you, but this is very tailored to you as the person because it has to fit within what you can do and what your joints will allow. So, hope you enjoy that. Thanks for watching, and we'll see you at the next video.